nothing is ever stagnant. Change is happening all around us, even in times of scarcity. When a community becomes so desperate to fill a void, ideas become visions. We ask, if not here, where? If not us, who? If not now, when? Sometimes an individual is called upon to catalyze change. Sometimes it is a tribe. It's not easy, it's messy, it's worthy, and a whole bunch of people coming together.
There's a critical need across America and across the state of Oregon, but most acutely in rural communities such as Roseburg, for primary care physicians. That compelling need is greatest in rural areas where it's harder to recruit and to retain qualified family physicians and other specialists as well.
This really started 3, 4, 5 years ago now, a vision of our CEO and some community members to improve access and to improve the entire medical community. If you think about it, Roseburg, greater Roseburg area, we have a population of about 88,000 we serve. To start a residency program at first was a bit unheard of. With the leadership of a lot of people, the CEO, Kelly Morgan, Dr. Chip Taylor, and many others, brought a lot of moving pieces together to bring this to fruition.
There is a severe shortage of primary care providers. The primary care provider shortage is growing across Oregon, with a projected statewide shortage of 622 primary care providers by 2020, rising to 1,174 by 2030.
We were turned down for the doctor, and I thought, what in the world is going on? We're reliable people, we pay our bills on time, and we really do need to see a doctor at some point. And come to find out, there were just no doctors available.
There was a study done recently by the hospital here in the community that suggests we're short about 19 primary care providers, physicians. The so what of that is folks are having to go really outside kind of our geographical area to see primary care providers, which is not the right standard of care, in my opinion. It should be very accessible.
We have had at least 2 different doctors here in town that have treated us for a while. We both have heart issues. And within about a year or so after we got started with them, they transferred to someplace else to a better opportunity. And it becomes very difficult to find a practice that you can get into and be a part of down here.
The number one thing I hear from the community is, I'm frustrated with the provider turnover. It seems like you guys can't hold on to a provider, and I totally get that.
Providers who are part of our community and are here for a number of years become so critical to developing those trusting relationships that really begin to provide that security to our patients.
Research published in the Journal of Family Medicine demonstrated more than half of family physicians practice within 100 miles of their family medicine residency program. In addition, the majority of practicing family physicians remained within proximity to their GME training site.
So if we have 3 years of people living in our community and working, then the stickiness of them putting down roots into the community will make it easier to retain them. Or if we have them go somewhere else, they'll be looking for a similar type of experience.
We're looking at hoping that they will really enjoy living in Roseburg, becoming a part of the community, whether it be in social events, faith-based organizations, their children in school, that they will, at the end of their 3-year residency, think, okay, we'd like to stay here as a family. I'd like to stay here as a doctor and be a part of this community.
We had over 600 applicants for our 8 positions.
When I was a part of the interview process, a couple of the questions that were important to me were, what were their thoughts about a rural community? Where were they coming from? If it was somebody who had grown up in the middle of New York City, would coming to Roseburg, Oregon be a tremendous adjustment for them, or were they looking for a totally new, different lifestyle?
How does a small community train exceptional family physicians who are ideally suited for rural practice in the 21st century? This doesn't happen overnight, nor does it happen in a silo.
First and foremost, we want to train exceptional family physicians who are ideally suited for practice in a rural community in the 21st century. When we think about these folks, the trainees, the residents we're going to have, and how we're going to equip them, they need to be experts in managing data and understanding the evidence and being able to translate it into action. They need to be experts in leadership of teams. They need to be experts in thinking about the individual in front of them, the population that they're entrusted to care for, and the community in which they live as the milieu in which all this care occurs. They need to be able to sustain themselves and their teammates, who will be of all different sorts of disciplines. They need to understand technology and to humanize it so that when they're dealing in the clinic with a patient, it's still that caring environment. They need to be able to translate doctorese into plain English for people who are relatively plain spoken. They need to understand how to change behaviors, and they need to understand how to treat pain and suffering without the use of opioids. And when people are addicted to those substances, to be able to help them to overcome that addiction, whether it's alcohol or methamphetamines or opioids.
The Roseburg Family Medicine Residency has teamed up with critical partners to help create team-oriented and community-involved rural family doctors that will change how we view healthcare in a small community.
So the best laid plans of mice and men, we should have had our first class of residents on board in 2019, and we don't. And the reason we don't is tied up in the lore of who will ever know. But our first teaching clinic decided that they didn't want to participate, which almost killed the residency. Fortunately, we were kept on life support, and I was able to pivot to the federally qualified health center.
It really takes people who have energy, have vision, and are willing to bring other people along. And you know, I mean, it had to start with Chip. Chip was the one who started it and really just plowed through amazing hurdles to get us to that point. And then Casey was that second person to take the reins next and do that next part. So I think the initial turning point was having Aviva come on board, and having so much power of positivity from Casey. I was really impressed meeting with him and seeing how much he wanted to move this forward.
Other partnerships that are essential are with the OPTI, which is the organization which oversees our academic requirements, and without them we would not have the ability to have a residency. And then the final key partnership is with an organization called ADAPT, which has the substance use disorder and mental health contract, for lack of a better word, for our county. This project wouldn't have started if it wasn't for a small amount of grant money through the Oregon Graduate Medical Education Consortium, which required matching funds with the hospital to get this started. One of the things that we are very proud of was that we were able to compete through the federally qualified health center to become one of the 5 new teaching health center grant recipients for this coming year. And then in addition, a workforce development grant from the state of Oregon. So ending up at the federally qualified health center gave me a different mission, caring for those people who most needed the care in our community, regardless of their ability to pay, regardless of their ability to show up for appointments on time, just regardless. And then when this opportunity came along to help train the next generation, what this gave me was an opportunity to envision what those doctors would need to be caring, compassionate physicians into the 21st century, so that we can keep those people long-term engaged in primary care for the individuals that entrust themselves to them, to the communities in which they serve, and to the discipline of family medicine and to the nation as a whole.